Are you in class right now?
I'm waiting on students.
Students. Do you know how to move the students in lab?
No.
Can I show you
Yes.
later today? And I'll let you.
Yeah, I'm.
Perfect. If you'll just remind me when you
Yeah.
get done with that.
Oh,
It's super
I've
easy.
got a student. Hi, Lauren Lee. Lauren Lee. I just want to compact it and make it one syllable.
Morning.
Oh, I gotta turn that volume up. There we go. I'm gonna go ahead and jump in and get started since we're already at 6 after.
Okay.
We're going to be doing HIV/AIDS packet as well as the prevention of medical errors packet. Those were both made available on MindTap. I don't remember what they were called. If you didn't get them printed out, there are some highlights, so I will I will say when there's highlights, and if we need to slow down, if you're taking notes not directly on the packet, just let me know. Otherwise, we're just gonna read through. They're pretty easy today. Dry material, but important material that you will have to know and deal with. So let's start with the prevention of medical errors. Now, let's talk about the definition of a medical error. Medical errors are one of the leading causes of injury and death in our nation's healthcare industry. What are medical errors? Medical error happens when a part of a medical treatment plan does not work correctly or is misinterpreted, resulting in injury or death. Or quite possibly, the incorrect plan was used in the first place. Medical errors have been defined as the failure of planned action to be completed as intended, or the use of a wrong plan to achieve an aim. Errors depend on two kinds of failures. Either the correct action does not proceed as intended, known as an error of execution, or let's go ahead and highlight here. The original intended action was not correct, otherwise known as an error of planning. Where medical errors occur. Medical errors can happen at any point in the healthcare process, in the process of healthcare for the patient. Highlight that. Medical errors can happen at any point in the process of healthcare for the patient. Got a tickle. The points in the process of healthcare are diagnosis, anytime during treatment or surgery, as well as preventative care. When one thinks of errors being made in the healthcare system, one tends to automatically assume the errors were made in a hospital. We've all read of the nightmare scenario of wrong body areas receiving surgery or wrong medications given, but in the healthcare system, the healthcare system compromises of more than just hospitals. Let's go ahead and highlight here. Healthcare systems include hospitals, clinics, outpatient surgery centers, doctor's offices, nursing homes, pharmacies, and the patient's home. So anywhere you can receive healthcare services, that connotates a healthcare facility. Ergo, you can have medical errors in any of those facilities. Types of medical errors and approaches for prevention. Medical errors mainly involve 6 different types: medicines, hospital stays and surgery, diagnosis, equipment, lab reports, and system failures. They can occur during the most routine tasks involving one or a combination of the 6 types at any one or several of the locations. Medicines. Medical errors may start at the point when the doctor writes a prescription. When a doctor writes your prescription, you should make sure that it is legible. If you cannot read it, chances are the pharmacist might not be able to read it either. When you pick up your prescription, it is also good practice to inquire if this medicine is indeed the one the doctor prescribed. According to the study of Massachusetts College of Pharmacy and Allied Health Sciences, 88% of medicine errors involve the wrong dosage or the wrong drug. I've seen at the pharmacy before, not with myself, but with other people around me, is the pharmacist knows everything that a single patient is picking up. So where two different doctors may be prescribing different things, those doctors may not communicate. So they don't know that they're prescribing two different things that have adverse interactions when taken together. So it falls upon the duty of the pharmacist to tell that patient, hey, you can't take these two together. You've got to call these doctors and have them get their brains together to figure out what between them, what you can take to facilitate the same goals of the medications that they're prescribing. Other medical errors that involve medications are an allergic or adverse reaction to the medication prescribed. Go ahead and highlight here. Misinterpretation of the directions on the label. All right, that's very important. For example, do 4 doses do 4 doses daily mean taking a dose every 6 hours around the clock, or taking it during waking hours? Be sure to clarify your prescription with both your doctor and your pharmacist. I always ask, I read the bottle and I say, okay, what exactly does this mean? Take 2 morning and night, you know, I'm picking it up in the afternoon. Do I need to take the 2 doses that were for today, or do I need to wait till tomorrow morning to start fresh and do my dose in the morning, my dose in the evening? And they'll usually clarify it for you. The pharmacist has a wealth of knowledge. Went to school long enough. All right, hospital stays and surgery. If you're admitted to a hospital for medical care, regardless of the reason, if the reason is surgical or non-surgical, it may be better to choose a hospital that has a great deal of experience with your condition. Patients tend to have better results when they are treated in hospitals that specialize in treating specific condition. Hand washing, now that we've learned this recently, is an easy and important way to prevent the spread of infection in healthcare environments. While in the hospital for medical care, considering inquiring of all healthcare workers with whom you have direct contact, whether they wash their hands prior to the actual contact with you. Most of the time you'll see them, if you are staying in a hospital, they come in and the first thing they do is hand sanitizer or straight to the sink and they wash their hands. No matter how many times they've done it that day, every single person deserves clean hands put on them. If you are admitted to the hospital for surgery, be sure to verify all that is expected to happen. For instance, be sure that you understand the dynamics of the surgical procedure. Who are the doctors involved with the surgery? How long will the surgery take? What is the post-surgery procedure? How long will recovery be? How can I expect to feel during recovery? Make sure the surgeon, anesthesiologist, and nurses know of any history of allergies or reactions to anesthesia. And finally, make sure you, your doctor, your surgeon, and the anesthesiologist all agree on what exactly will be done during the surgical procedure. This simple act of inquiry will cut down on possibility of surgery being performed on the wrong site. For example, operating on the left foot instead of the right. Yes, medical errors like this do happen. It may be recommended to have the designated person, either a spouse, family member, or a friend, to be present at all the meetings with the doctor. It is also recommended that they be with you during the hospital stay, just to make sure that your care is being executed properly. This spokesperson would be able to speak on your behalf if you are unable to speak for yourself. They would be able to follow up with nurses present to make sure your post-surgical care is being executed competently and correctly. It's very important in a hospital setting to have an advocate for you. If you are incapacitated with from coming out of anesthesia, or if the patient is you know, something goes wrong in surgery and now they're in a medically induced coma, they need to have someone there to advocate and make decisions for them that are on their best interest. Upon discharge from the hospital, be sure to ask the doctor to explain the home treatment plan. The home treatment plan may include information about medications cited above, dietary concerns, if any, and the time frame for return to your regular activities. Diagnosis. Let's go ahead and highlight here. A wrong or misdiagnosis can lead to an incorrect choice of treatment. And highlight. Usually, specific diagnostic tests are indicated to confirm certain conditions. Failure to use indicated diagnostic tests may lead to an incorrect diagnosis, an incorrect choice of treatment, or more unnecessary testing. Failure to use appropriate diagnostic tests may lead to misinterpretation of a test result, or failure to act on abnormal results. Also, inexperience with performing a difficult diagnostic procedure on the part of the healthcare worker can affect the accuracy of the test results. Always make sure the diagnosis is confirmed either by a second, more extensive test or by a second opinion. It is also good practice to receive direct confirmation of the results from any test procedure. Make sure you talk with your doctor about how you will get the results for a procedure or test. You may have to call and talk with them directly or set up a follow-up appointment. Do not assume the results are fine if you do not hear from your doctor after the test. Also ask what the results of the test will mean in terms of your health care. It's been my experience that they usually make appointments to discuss diagnostic testing. Equipment failure can lead to failure to complete a medical plan of action, thus leading to a medical error. Dead batteries resulting in equipment failure is a possibility with defibrillators. Intravenous pumps whose valves are accidentally dislodged or moved cause a change in dosage of medication. Be sure to inquire about the equipment that is being used in your healthcare treatment plan. Lab reports. Lab reports and diagnosis may go hand in hand. Usually, it is the results of a lab worker that tend to lead to a diagnosis. If the wrong lab work is ordered or misinterpreted, this could often lead to a misdiagnosis and medical error. Medical errors can be prevented through various means, the best of which is communication. You can protect yourself by taking time to talk to your doctor, nurse, or any other healthcare worker about the results of any lab test, the diagnosis, and the healthcare you are about to receive. So many people, I feel, don't feel like they have the authority to question the doctor. When it comes to your health, you have every right to question. System failures. Medical errors can even result from systematic organization of healthcare. The organization of healthcare includes the treatment plan and its systematic delivery to the patient, along with the resources that are provided to the delivery system. For example, a major study discovered that failures in the delivery system accounted for 3/4 of adverse drug events. In other words, patients were given the wrong dosage of prescribed medication or given the wrong medication in the first place. Another example of system-level problem is the correlation between staffing levels of nurses and the incidence of adverse events following major surgery, such as pneumonia, thrombosis, pulmonary compromise, and urinary tract infections. Understaffed post-surgical wards and nurses are overworked and fatigued, may result in numerous types of medical errors, including adverse drug events, equipment failures, or breakdowns in delivery system of the treatment plan. Constant monitoring of a system protocol and making changes in system organization and design can decrease adverse events of medical errors resulting from healthcare delivery system failures. These changes may include reorganization of resources, the reorganization of decision-making upper level management, and/or retraining of all healthcare workers involved. Recommendations for improving patient safety. In June 1998, the Institute of Medicine Quality and of Healthcare in America Committee was formed to help develop a strategy for quality improvement of healthcare. Their report, To Err is Human, Building a Safer Health System, addressed patient safety issues, quality-related healthcare concerns, and laid out a national agenda for reducing medical errors and improving patient safety in the healthcare system. The strategy was planned and implemented over the next 10 years. The committee concluded that the major force for improving patient safety is to motivate healthcare providers who are grounded by professional ethics and expectations. The committee feels these specific healthcare providers have knowledge and tools to make patient safety the norm and will provide strong, visible leadership within the healthcare culture. This action would encourage recommendation and learning from medical errors and create an effective patient safety program. Other recommendations for reducing medical errors include improving system protocols within healthcare organizations. These include, go ahead and highlight here, designing systems that take into account patient safety. This would include a healthcare provider's work hours and workload, and highlight. The healthcare organization should have enough qualified workers in the system to enable balanced workloads and staff rotation. This would reduce the tendency for overwork, thereby reducing the possibility of medical errors happening as a result of distraction and fatigue. So if they have more people to carry the load, the load can be carried better. Let's go ahead and highlight here. Avoiding reliance on memory. A study by the Agency for Healthcare Research and Quality, AHRQ, found that patient chart review completed by a qualified worker was more accurate than computer tracking and voluntary reporting for identifying adverse drug events. Ugh. And highlight. But required 5 times more personnel time. The study concluded that computerized methods for tracking drug errors was more efficient. Avoiding reliance on vigilance. Another AHRQ study that found that a computerized reminder system to alert physicians to proper timing of repeated tests reduced the number of patients being unnecessarily retested. The AHRQ went on to report that automatic alerting systems for communicating critical lab results reduce the waiting time for appropriate treatment. Standardized work processes. The AHRQ concluded in another study that standardizing healthcare protocols would decrease the incidence of medical errors. For example, they found that patients in intensive care units with severe respiratory disease showed a 4-fold increase in the survival rate with the use of computerized treatment protocols. The Agency for Healthcare Research and Quality continues to research ways to improve the delivery of quality healthcare through identifying high-risk patients or patient groups, high-risk providers, and high-risk healthcare processes and settings. In addition, the AHRQ continues to develop generalized methods for error reduction. Our healthcare system is becoming increasingly complex, and while research continues to find ways to improve the delivery of healthcare and the reduction of medical errors, one of the most important keys to the problem may be the simplest. That key is communication. Medical errors happen when doctors and patients have trouble communicating. The Agency for Healthcare Research and Quality found doctors often do not effectively communicate with their patients in order to help them make informed decisions about their healthcare. As a result, patients tend to be less involved and less informed about their healthcare choices, less likely to accept the doctor's choice of treatment, and less likely to follow through with treatment. The single most important way a person can help prevent medical errors from happening is to be an active member of their healthcare team. So you have to be informed. You have to do just as much research as your doctor is doing to understand what's happening. Excuse me. It is important for massage therapists working as part of the healthcare team to be well aware of and participate in medical error prevention. But what about the massage therapist who is working at the massage establishment, a gym, a spa, a salon, or in a private practice? What are the important items that every massage therapist should have awareness of? And is there any additional information the therapist should know that would be more specific to their scope of practice? When a massage therapist applies this information, they need to be concerned with the specific medical error that can be defined as an error of execution or an error of planning. For the massage therapist in private practice, errors of execution and errors in planning can result from a misunderstanding of their scope of practice, improper sanitation and hygiene practices, not practicing universal precautions, and incomplete knowledge of contraindications and endangerment sites. These 5 items will be discussed with an understanding that medical errors may not be limited to those, and may also encompass some areas of massage therapy that are not covered. The scope of practice for massage therapy. The scope of practice of a profession defines its parameters, minimum standards, and knowledge base. Every healthcare profession has a unique knowledge base and practice parameters that make their scope of practice unique. Scope of practice is also defined by whatever legal body, state, province, federal government that has the authority to set parameters of the profession in terms of what it can and cannot be performed. A professional operating outside their scope of practice will constitute a violation of law. State of Florida. Massage therapy in the state of Florida is regulated by the Department of Health, Board of Massage Therapy, specifically Florida Statute Chapter 480, known as the Massage Practice Act, Section 480.031, FS, and has received specific recognition by the Florida legislature as therapeutic practice. The primary purpose of the regulation of massage therapy in the state of Florida is to protect the public. In Chapter 480 of the Massage Practice Act states, purpose. The legislature recognizes that the practice of massage is potentially dangerous to the public and that massage therapists must have knowledge of anatomy, physiology, and an understanding of the relationship between the structure and function of the tissue being treated and the total function of the body. Massage is therapeutic, and regulations are necessary to protect the public from unqualified practitioners. It is, therefore, deemed necessary in the interest of public health safety and welfare to regulate the practice of massage in the state. However, restrictions shall be imposed to the extent necessary to protect the public from significant and discernible danger to health, and yet not in such a manner which will be unreasonably affect the competitive market. Further, consumer protection for both health and economic matters shall be afforded the public through legal remedies provided for this act. The legal definition of massage therapy in Florida is, go ahead and highlight here, the manipulation of soft tissues of the human body with hand, foot, arm, elbow, whether or not such manipulation is aided by hydrotherapy, and highlight, including colonic irrigation or thermal therapy, any electrical or mechanical device or application to the human of a chemical or herbal preparation. The purpose of the Massage Practice Act is specific in its purpose to protect the public, realizing that massage practice can be potentially dangerous when practiced by an unqualified practitioner. While the legal definition of massage therapy and the regulation thereof is identified as the scope of practice for massage therapy profession in the state of Florida, as a scope of practice, this definition in Florida statutes Chapter 480 is not well defined by the Board of Massage Therapy. And compared to other scope of practice, this definition may be considered very general in nature. While the definition of massage therapy in Chapter 480 generally defines what massage is, the manipulation of soft tissues of the human body, etc., it does not define the type of manipulation that is used, only the part of the body that it can be used to perform the manipulation. It goes on to state that it can be used to assist the soft tissue manipulation, but that does not go further to define those specific aids. This may lend itself to a broad interpretation of just what the scope of practice for massage therapy truly is in the state of Florida. Go ahead and highlight here. Because of this, Generalized definition of massage therapy. The massage therapist should familiarize themselves with the scopes of practice of other healthcare professions of which massage therapy is complementary therapy. Identify specific recommendations for sanitary practices for massage businesses. Massage therapists should know the importance of washing hands between sessions, but how many of us forget to clean our massage oil or lotion bottles? Highlight, maintaining good sanitary practices is the first step to reducing medical errors of execution or planning at our massage therapy establishments. It's not something you think of immediately, that you've touched someone and you've gone back to your bottle and touched it again. So why wouldn't you clean that? Then that just needs to become part of your cleanup procedure. I've cleaned my sheets, I've cleaned my table, I've wiped down my surfaces. Now I need to clean my hands and my bottle, right? And it all just become part of your routine. Sanitation guidelines for massage therapy professional. Hands and forearms must be cleaned and washed thoroughly with antibacterial/antiviral soap before touching each client. This step will reduce the spread of any communicable disease or infection from therapist to client and vice versa. And in any infected wound or open lesion or any exposed portion of the body should be contraindicated for massage until the condition is healed. You are washing clear up here, right? When you have contact with a client, you're using the end of your elbow a little bit further back. So this whole portion of your arm is going to have to be washed, not just your hands. This needs to be cleaned as well. Clean clothing must be worn daily. The massage therapy profession should wear fresh, clean work clothes on a daily basis. This step would reduce the risk of spreading any communicable disease or virus that may have come in contact with their clothing either at work or from home. For example, the therapist may have dressed in their work clothes prior to assisting a family member with the flu, then left to start their workday. The possibility exists that the flu virus may travel to work not only on the therapist's hands, but also on their clothing. The same goes for the therapist coming home after work. The clients may have had a cold or some communicable disease and would put their family at risk of infection. The massage therapy establishment must be maintained in good repair and free of all insects, rodents, and other vermin. All massage rooms should be well lit, well ventilated, and maintained with adequate heat and air conditioning, around 75 degrees Fahrenheit. All sewage and liquid waste must be disposed of in municipal sewage system or approved septic system. The water supply must be adequate, conform to state plumbing code, and deemed safe and sanitary by the health department. The massage therapy establishment must have sanitary toilet facility with adequate supplies of hot and cold running water and must be conveniently located for use of employees and clients. Soap in a covered dispenser and single-use sanitary towels in a dispenser and covered waste receptacle must be provided at each laboratory installation. A supply of toilet paper on a dispenser must be available at all toilets. The lavatory and toilet rooms must be equipped with fly-tight containers for garbage and refuse. These garbage cans must be easily cleanable and well-maintained in good repair. Highlight, number 7, massage lubricants, including but not limited to oils, lotions, powders, and alcohol, should be dispensed from suitable containers to be used and stored in such a manner as to prevent contamination. The bulk, we're going to end our highlight, the bulk lubricant should be stored separately from the container you use for application that comes into contact with the client or massage professional must be discarded. Oh, excuse me, I skipped a line. The bulk lubricant should be poured, squeezed, or shaken into a separate container. Any unused lubricant that comes into contact with the client or massage professional must be discarded. The container used for application should be cleaned with alcohol before each session. So if you use a massage cream and you take a dollop of it and you put it on your upper forearm to use throughout the massage, you have any left, you can't save that. That's contaminated. You must scrape that off, into the garbage it goes. Only freshly laundered sheets and linens should be used for each massage. Do not reuse soiled or unclean linens. All clean linens must be stored in compartments, shelves, or cabinets at least 4 inches off the floor. All soiled linens must be placed in a covered receptacle immediately after use and should remain there until washing. All soiled linens should be washed in a machine at a hot water temperature of at least 140 degrees Fahrenheit with detergent and an antiviral cleaning agent, at least 10% bleach solution. Massage tables must be covered with an impervious material that is cleanable and must be clean and in good repair. The tabletop must be cleaned thoroughly with soap or other suitable detergent and water, followed by adequate sanitation, at least 10% bleach solution again, procedure before each individual client. Right. So what they mean here is the vinyl on your table can't have a little slice in it, because what that's doing is exposing the foam that makes up the padding of your table, and that foam cannot be cleaned, right? So we need to make sure it is one full sheet of vinyl, completely protected. If you do have a tear in your vinyl, you need to get a cover to protect it. Observe the following rules when cleaning the massage area. Clean from the cleanest area to the dirtiest. This prevents soiling of a clean area. Clean away from your body in uniform. If you dust, brush, or wipe towards yourself, microorganisms will be transmitted to your skin, hair, and uniform. Do not shake linen. It is best to dust with a damp cloth to minimize the movement of dust. Used linens must be stored in a closed bag or container while in the massage room or during transport. Floors should be considered dirty. Any object that falls on the floor should not be used on a client. If it falls on the floor, it is dead to you. It is dead to you until you can pick it up and clean it after the client is left. The 10 guidelines as noted above are consistent with Florida Administrative Code Chapter 64B7-26.003, Massage Establishment Operations. Universal precautions. Universal precautions, as defined by CDC, are a set of precautions designed to prevent transmission of human immunodeficiency virus, HIV, hepatitis B virus, HBV, and other bloodborne pathogens when providing first aid or healthcare. Under universal precautions, blood and certain body fluids are considered potentially infectious for HIV, HBV, and other bloodborne pathogens. Universal precautions were developed initially to prevent the spread of these potentially infectious pathogens. Universal precautions should be implemented for the protection of the client as well as the massage professional. So if you come into contact with, if the instance of you having the potential to come into contact with blood, you must treat that bodily fluid as if it were infected with HIV, HBV, or any communicable bloodborne pathogen. And by treating it like that, you minimize your risk of infection because it all gets the same treatment. You don't look at people and say, well, I know they don't have anything, it's fine, I can clean it up with my bare hands. No. Gloves, always. Bleach, always. Universal precautions apply to blood and other bodily fluids containing visible blood, semen, and vaginal secretions. Contact with other body secretions such as feces, nasal secretions, sputum, sweat, tears, urine, and vomit should be avoided, especially if they contain visible blood. Implementation of universal precautions. Number 1, the use of protective barriers such as gloves, gowns, aprons, masks, or protective eyewear. Number 2, precautions to prevent injuries caused by needles, scalpels, and other sharp instruments or devices. Number 3, let's go ahead and highlight here. A 10% bleach solution should be used to clean up bodily fluids. Stronger bleach solutions should be used if excessive amounts of blood or other substances are present. and highlight. Number 4, linen should be rolled away from you and double bagged in plastic, separately from other soiled linens. The outside bags should be labeled contaminated with bodily fluids. Universal precautions must be used when working with clients who are more susceptible to infection. This includes clients or patients that may be infected with bloodborne pathogen like HIV or HBV or other contagious conditions, as well as conditions that cause immunosuppression, including excessive stress. A medical error would occur if a client or therapist were inadvertently exposed to a blood-borne or other contagious pathogen as a result of universal precautions not being implemented. The best recommendation for massage therapy and bodywork professional is to make universal precaution a permanent part of their practice. For the massage and bodywork professional, this includes, go ahead and highlight, the use of gloves. Gloves should be used if the skin of the client or the massage therapist has a rash, cut, abrasion, infection, or any other condition that would allow the transmission of body fluids. If there is a disruption in your skin, put a glove on. I don't care if it's a little bit of dry, flaky skin. Dry, flaky skin is basically, if we looked at it at a microscopic level, just screaming open. Just all those little cells standing right open going, come on, pathogens, come right on in, because we've disrupted the barrier. Number 2, the use of a mask. A mask may be necessary in the transmission of airborne pathogens like flu virus is a concern. Go ahead and highlight that. The use of a mask. A mask may be necessary if transmission of an airborne pathogen like the flu virus is a concern. We learned a lot about masks recently in this whole pandemic we're experiencing. A mask worn by a therapist can also protect the client from the therapist's airborne pathogens if the client has any form of immunosuppression. The immune suppression makes the client more susceptible to infection. So something that you may be carrying fought off and now we're an asymptomatic carrier, we've heard that term recently, might be quite detrimental to someone who has a compromised immune system. So we have to do our due diligence to protect them. Number 3, hand washing. Proper hand washing may be the single most effective deterrent to the transmission of disease. The massage and bodywork professional must wash their hands before and after each massage. This would also include after blowing their nose, coughing into their hands, and using the toilet. That should be common knowledge, but we have to tell people. Hands should be washed in hot water, preferably with an antibacterial soap, starting from the forearms to the hands, always holding hands down so as to not reinfect, then dry the same way from forearms to hands with clean disposable paper towel. The towel should be used to turn off the water at the faucet. So you're going to wash, clear up your arms, and hang them down. When you leave the sink, get your paper towel. You're going to dry down, then turn your water off. Number 4, sanitation of the environment. Equipment that is used within the context of the massage session should be also cleaned before and after the massage session. This includes door handles of the massage room, the oil / lotion bottle, the bottle holster if one is used, hydroculator units, hot or cold packs, or any other equipment that the therapist or client comes in direct contact with. In other words, anything that may assist in the spread of a contagion from one client to another or between the client and therapist. If it touches one client, it cannot touch another until it has been properly cleaned, period. No questions asked, right? If you have a massage blanket on your table and your client takes their arms out from underneath the sheets and lays their arms on that blanket's contaminated now. You must take it away. Right, of course, after the client has left, that's contaminated. We don't rip it off them right out there on the table. All right, identification of contraindications. Let's highlight here, any symptoms or circumstance indicating the inappropriate of form of treatment is defined as contraindication, and highlight. Knowledge of contraindication is imperative for a massage therapist or body worker in the private practice. Performing a massage technique in an area of the body that should be contraindicated for the treatment may fall under medical error of execution or error of planning, or both, as defined at the beginning of the document. Sometimes massage therapists and body workers have difficulty making recommendations for a specific treatment when each treatment situation may be different. Each situation needs to be individually evaluated to determine whether massage is indicated or contraindicated for treatment. The existence of contraindications doesn't always mean massage or bodywork is inappropriate. The contraindication may fall under one or more of the following general categories. General avoidance of application. Do not perform any massage or bodywork techniques. Regional avoidance of application. Perform massage but avoid particular areas. An application with caution. Requiring supervision from appropriate treating physician or supervising personnel. Do not perform massage, but carefully select the method. Do perform massage, but carefully select the method, duration, and frequency of application. Applying massage on contraindicated areas can be avoided if the massage therapist and body worker takes the time to perform an intake and assessment of the client's health prior to starting the massage therapy session. This information should be confidentially kept in a client file. This file should include at least the following information. Number 1, pertinent client information such as name, address, phone, and other contact numbers, emergency contact, etc. Number 2, a complete health history should be taken from the client, including the following: a history of recent and past injuries and conditions, a list of all prescriptions, over-the-counter, and herbal medications, a written assessment from the therapist body worker stating the client's current condition, an informed consent form signed by the client agreeing to receive treatment, a medical information release form signed by the client allowing the therapist to consult with their physician, and documentation notes of each treatment received by the client. Taking time to obtain this information from the client will help the therapist reduce the incident of medical error in execution of massage therapy technique and an error in planning of a wrong treatment approach. So you have to do your due diligence to make sure that you are providing the exact care that the client would need. The massage community generally accepts the following contraindications. Cardiovascular disorder. Let's go ahead and highlight cardiovascular disorders. Over any bruises or vessels that are inflamed, diseased, or could be easily damaged. On a bleeding wound because of the possibility of infection. On clients with known blood clots or with conditions where clotting may be a symptom, clots in blood vessels could be dislodged by massage, creating the risk for heart attack or stroke. Depending on the severity, let's go ahead and highlight. General conditions that may contraindicate massage include, but not limited to, aneurysm, arterial sclerosis and atherosclerosis, congestive heart failure, deep vein thrombosis or DVT, hemophilia, phlebitis, varicose veins. Sensory abnormalities. Number 1, when the client cannot feel heat, pain, or pressure. You'll experience that with some of your diabetics on their feet and legs. When a condition is present where the client may experience hypersensitivity to touch, you may experience that with someone who has fibromyalgia. Skin disorders. Any infectious skin disorder because of the possibility of spreading the infection to other parts of the body, to the therapist, and even to other clients. Any skin condition that can be irritated by massage strokes. Inflammation. Massage therapy over tissues that are inflamed could increase the inflammatory response of that tissue. Infection. Infectious condition might spread to other parts of the body, to the therapist, and even to other clients. Fever. When a client has an elevated body temperature, this symptoms may be an indication the client has a serious disease or condition. Fever is one of our very first symptoms of more complex issues. Edema. Areas of edema, swelling that are unexplained or caused by kidney problems, heart failure, or some other serious disorder. Pregnancy. Deep massage of the abdomen and around the ankles. Heavy deployment anywhere on the body. Massage therapists and body workers should receive specialized training in pregnancy massage before working with pregnant women. Gastrointestinal disorders, conditions that may show symptoms of abdominal pain, diarrhea, nausea, and vomiting. Mental and emotional disorders. Clients with serious mental or emotional disorders require knowledge out of the scope of practice of the massage therapist and body workers. To work with such clients, the massage therapist or body worker should work as part of a healthcare team under the supervision of the treating physician, psychologist, psychiatrist, or other licensed healthcare provider. Loss of tissue integrity. When the normal anatomy of the client has been disrupted by an event such as surgery, soft tissue trauma, joint replacement, and severe bone degeneration, contraindicated for massage therapists and body workers unless working with the authorization of the treating physician. Let's go ahead and highlight cancer. Malignant cancer may spread, metastasis, through the blood or lymphatic vessels. Because massage therapy increases the circulation in these vessels, it may be contraindicated to prevent the spread of any malignant cancer. Treatment should be done with prior approval from the treating physician. Then we have benign tumors. Benign tumors are not malignant and do not metastasize throughout the body, but massage therapy could damage the tumor itself, so it is contraindicated for the tumor area, but not other parts of the body. Endangerment sites. Let's go ahead and highlight. An endangerment site is a region of the body which nerves, arteries, or veins lay close to the body's surface. And highlight. These areas are not well protected by muscle or connective tissue and have the potentiality to be damaged. Deep pressure, either sustained or through friction, would cause contraindication for the vessel and nerves in these areas. These areas may contain bony projections that are fragile and may be broken. Massage therapists should exercise extreme caution when working in or close to these endangerment areas. A medical error in execution may occur when a massage therapist or body worker does not exhibit extreme caution when working in one or more of these areas, and injury results of the treatment. So endangerment sites to the face and neck. Let's go ahead and highlight this first one. The anterior triangle of the neck. The anterior triangle of the neck consists of the medial border of the sternocleidomastoid or SCM muscle, the inferior border of the mandible and the trachea. It contains the jugular vein, the carotid artery, the vagus nerve, which are located deep to the SCM. So those are some pretty important anatomical pieces. I don't know the word I want there. That don't have a large amount of heavy protection. You know, they're a fairly soft area that they could be damaged. So as a massage therapist, you need to be aware of what's going on underneath the musculature that you're affecting. All right, and then we have the posterior triangle of the neck. The posterior triangle of the neck consists of the posterior border of the SCM, the superior border of the clavicle, and the anterior border of the upper trapezius muscle. This area contains the brachiocephalic artery, the vein superior, and vein superior, the clavicle, the subcephalic vein, and the nerve of the brachial plexus. We have the posterior to the mandible. The area posterior to the mandible contains the facial artery and nerve and the styloid process of the temporal bone. The styloid process is a very delicate bone that can be broken from extreme pressure. We have the sternal notch and anterior throat. The area of the sternal notch and anterior throat consists of the medial heads of the right and left clavicle and their attachment at the superior edge of the sternum. This area contains the vagus nerve and the nerve and vessels to the thyroid gland. Endangerment sites of the shoulder. We have the axillary triangle of the underarm. The axillary triangle of the underarm consists of the anterior edge of pectoralis major, the posterior edge of latissimus dorsi, and the superior head and medial shafts of the humerus. The upper ribs and medial aspect of serratus anterior. This area contains the nerves of the distal brachial plexus, the brachial artery, the axillary nerve, vein, and artery, and the cephalic vein. Then we have the deltoid pectoral triangle. The deltoid pectoral triangle is a narrow area between the medial aspect of pectoralis major and the lateral aspect of the anterior deltoid, and the superior border of the clavicle. This contains the cephalic vein. Endangerment sites of the elbow. Medial elbow. This area between the medial epicondyle of the humerus and olecranon process of the ulna. This contains the ulnar nerve. Lateral elbow. This area between the lateral epicondyle of the humerus and the olecranon process of the ulna. This contains the radial nerve. Endangerment sites of the abdomen. Umbilicus area. The umbilicus area to either side contains the descending aorta and abdominal aorta. The dorsal body area, 12th rib. The dorsal area in the region of the 12th rib is located over the kidneys in the lower back. Endangerment sites of the lower extremity. We have the femoral or inguinal triangle. The femoral or inguinal triangle consists of the lateral aspect of the sartorius muscle, the superior aspect of the inguinal ligament, and the medial aspect of adductor longus muscle. This area contains the femoral nerve, the femoral artery and vein, the great saphenous vein, external iliac artery, and the inguinal lymph nodes. We have the sciatic notch. The sciatic notch is located in the area in which the sciatic nerve passes out of the pelvis through the greater sciatic foramen under the piriformis muscle. Popliteal fossa. The popliteal fossa is a diamond-shaped area in the posterior knee. The superior area consists of the lateral tendon of the biceps femoris and the medial tendons of the semitendinosus and semimembranosus and the sartorius muscles. The inferior area consists of two heads of the gastrocnemius muscle. This area contains the popliteal artery and vein and tibial and common peroneal nerves. Deep calf. The deep calf region of the lower extremity can be located between the two heads of the gastrocnemius muscle. This area contains the posterior tibial artery and vein. And the tarsal tunnel. The tarsal tunnel is located in the groove on the medial aspect of the calcaneus, inferior to and posterior to the medial malleolus. This area contains the posterior artery and vein deep to the flexor reticulum. In conclusion, medical errors are one of the leading causes of death and injury in the nation's healthcare system, yet improving healthcare system protocols that are reinforced by a management grounded in patient safety and professional ethics can prevent the majority of errors. While not all medical errors end in death, it is wise for a healthcare organization to review all adverse treatment events, which may have contributed to a medical error. Consistent review would help to assess the potential for a similar adverse event to occur in the future and whether it could be prevented. Medical errors don't necessarily only happen at hospitals. They can occur almost anywhere healthcare is being administered to a patient. This could be a long-term patient in a hospital, a person taking a prescription at home, or a person receiving a massage at a massage therapy establishment. Medical errors can occur during routine tasks involving medicine, hospital stays, surgery, diagnosis, equipment, lab reports, and system failures. By implementing the procedures discussed in this course, the massage therapist and body worker will become vigilant in reducing the risk of medical errors of execution. Performing wrong technique on a resulting area of an injury or causing an injury, including endangerment sites and medical errors of planning, implementing the wrong treatment protocol, or not implementing the universal precautions for protection of the client. Hi. For the massage therapist and bodywork in the private practice, having knowledge of medical errors and prevention is vitally important for protecting the public from potentially dangerous aspects of our work. To reduce the incidence of medical errors and executions and medical errors of planning, a massage therapist must have a working knowledge of anatomy, physiology, and understanding of the impact of the massage techniques on soft tissue of the body. A massage therapist or body worker must also have a clear understanding of the correct sanitary practices, hygiene practices, and universal precautions to protect the client as well as themselves from the body worker. Excuse me, I lost my place. To protect themselves from risk of cross-infection from bloodborne pathogens or virus. The massage therapist and bodywork must have a clear understanding of the massage therapy and bodywork contraindication and endangerment sites of the body. And finally, the massage therapist must be able to apply all of this knowledge within the scope of practice of massage therapy and bodywork as defined by the state, province, or jurisdiction where they are working. And then finally on the back, we find all of our cited sources. Now, this packet right here is exactly why you go to school, because we need to learn all of this material in all the classes that we take to be able to protect the public from us. So we gain all of our knowledge and we use that knowledge to pursue the correct course of treatment, frequency of treatment, and avoiding treatment if necessary. We also use it to discover if we need to call in the physician to see if there is a contraindication, you know, and always err on the side of caution. I would rather not perform a massage when I should have than perform a massage when I shouldn't have. Always be careful, always do your due diligence and your research. All right. So let's move on to our AIDS HIV packet. Same thing here, we're gonna read through this. It's got some highlights that we'll need to go over and things that we'll need to discuss. This was, I believe, published in 2007, I want to say. So you will see in your assignments that we want to have you research between when this was published versus what treatments are now. We thought that that would be an interesting research assignment for you guys. So, HIV and AIDS. We try our best to change our information so you don't end up reading the same information every 2 years. So this is coming from parts of it are coming from like a continuing education course. This year's HIV course has some of the basic information, but we have also done a snapshot of how the disease began and how quickly it became an epidemic. In addition, this year we have added a section about HIV research is helping solve other medical conditions and how you should deal with HIV/AIDS employees. All right, so our learning objectives here. Define HIV and AIDS, list the risk factors for HIV, describe how research helps solve other medical conditions, describe how you should deal with HIV-infected employees. Introduction. Let's go ahead and highlight here. AIDS, acquired immunodeficiency syndrome, was first reported in the United States in 1981, and your highlight, and has since become a major worldwide epidemic. AIDS is caused by HIV, human immunodeficiency virus. By killing or damaging cells of the body's immune system, HIV progressively destroys the body's ability to fight infections and certain cancers. People diagnosed with AIDS may get life-threatening diseases called opportunistic infections, which are caused by microbes such as viruses or bacteria that usually do not make healthy people sick. More than 900,000 cases of AIDS have been reported in the United States since 1981, and many as 950,000 Americans may be infected with HIV, 1/4 who are unaware of their infection. The epidemic is growing most rapidly among minority populations and is the leading killer of African American males. Age is 25 to 44. According to the Centers for Disease Control, or the CDC, AIDS affects nearly 7 times more African Americans and 3 times more Hispanics than whites. In recent years, an increasing number of African American women and children are being affected by AIDS. In 2003, 2/3 of the U.S. AIDS cases in both women and children were among African Americans. Transmission. HIV is spread most commonly by having unprotected sex with an infected partner. Risky behavior. HIV can infect anyone who practices risky behaviors such as these: sharing drug needles or syringes, having sexual contact, and having sexual contact with someone whose HIV status is unknown. Infected blood. HIV is also spread through contact with infected blood. Before donated blood was screened for evidence of HIV infection, and before heat treating techniques to destroy HIV and blood products were introduced, HIV was transmitted through transfusion of contaminated blood or blood components. Today, because of blood screening and heat treatment, the risk of getting HIV from such transfusions is extremely small. Contaminated needles. HIV is frequently spread among injection drug users by sharing of needles or syringes contaminated with very small quantities of blood from someone infected by the virus. This is why that big movement came along not too long ago, where they were supplying clean needles to people who were going to inject drugs. Now, it seemed kind of counterintuitive to give the drug addict the drug, but by minimizing their exposure to this bloodborne pathogen, we actually saved a lot of lives in the long run. It was very controversial, though. It is rare, however, for a patient to give HIV to a healthcare worker or vice versa by accidental sticks with contaminated needles or other medical instruments. Mother to child. Women can transmit HIV to their babies during pregnancy or birth. Approximately 1/4 to 1/3 of all untreated pregnant women infected with HIV will pass the infection to their babies. HIV can also be spread to babies through breast milk of mothers infected with the virus. If the mother takes certain drugs during pregnancy, she can significantly reduce the chances that her baby will get infected with HIV. If healthcare providers treat HIV-infected pregnant women and deliver their babies by cesarean section, the chances of the baby being infected reduced to a rate of 1%. HIV infection of newborns has almost been eradicated in the United States due to appropriate treatment. A study sponsored by the National Institute of Allergy and Infectious Diseases in Uganda found highly effective and safe drug for preventing transmission of HIV from an infected mother to her newborn. Independent studies have also confirmed this finding. This regimen is more affordable and practical than any other examined to date. Results from a study show that a single oral dose of the antiretroviral drug nevirapine, I believe that's how it's pronounced, given to an HIV-infected woman in labor and another to her baby within 3 days of birth reduces the transmission rate of HIV by half compared with similar short course of AZT or azidothamidzine. For more information on preventing transmission of mother to child, there is a website here. Saliva. Although researchers have found HIV in saliva of infected people, there is no evidence that the virus is spread by contact with saliva. Laboratory studies reveal that saliva has natural properties that limit the power of HIV to infect, and the amount of virus in saliva appears to be very low. Research studies of people infected with HIV have found no evidence that the virus is spread to the others through saliva by kissing. The lining of the mouth, however, can be infected by HIV, and instances of HIV transmission through oral intercourse have been reported. Let's go ahead and highlight here. Scientists have found no evidence that HIV is spread through sweat, tears, urine, or feces. Casual contact. Studies of families of HIV infected people have shown clearly that HIV is not spread through casual contact such as sharing of food utensils, towels, and bedding, swimming pools, telephones, or toilet seats. HIV is not spread by biting insects such as mosquitoes or bedbugs. Sexually transmitted infections. If you have sexually transmitted infection, an STI, such as syphilis, genital herpes, chlamydia infection, gonorrhea, or bacterial vaginosis appears, you may be more susceptible to getting an HIV infection during sex with infected partners. Early symptoms of HIV infection. Many people do not have symptoms when they first become infected with HIV. They may, however, have flu-like illness within a month or two after exposure to the virus. This illness may include fever, headache, tiredness, and large lymph nodes or glands of the immune system easily felt in the neck and groin. These symptoms usually appear within a week to a month and are often mistaken for those of another viral infection. During this period, people are very infectious, and HIV is present in large quantities in genital fluids. Let's go ahead and highlight here. More persistent or severe symptoms may not appear for 10 years or more after HIV first enters the body in adults. Wow. All right, end your highlight. Or within 2 years in children born with HIV infection. This period of asymptomatic infection varies greatly in each individual. Some people begin to have symptoms within a few months, while others may be symptom-free for more than 10 years. Even during the asymptomatic period, the virus is actively multiplying, infecting, and killing cells of the immune system. The virus can also hide within infected cells and lay dormant. The most obvious effect of HIV infection is the decline of number of CD4 positive T cells found in the blood and the immune system's key infection fighters. The virus slowly disables or destroys these cells without causing any symptoms. So it kind of sets up its takeover. It goes in and it disables the fighters and then attacks. As the immune system worsens, a variety of complications start to take over. For many people, the first signs of infection are large lymph nodes or swollen glands that may be enlarged for more than 3 months. Other symptoms include often experienced months to years before the onsets of AIDS include lack of energy, weight loss, frequent fevers and sweats, persistent or frequent yeast infections, persistent skin rashes or flaky skin, pelvic inflammatory disease in women that does not respond to treatment, short-term memory loss. Some people develop frequent and severe herpes infections that cause mouth, genital, or anal sores, or a painful nerve disease called shingles. Children may grow slowly or be sick a lot. What is AIDS? The term AIDS applies to the most advanced stages of HIV infection.
Miss Christina, I'm sorry. Are you on page 2?
Yes.
Page 2 wasn't in the
No.
yeah, so it goes from 1 to 3. I was like looking, trying to figure out where you were at, and I couldn't find it.
Do you have page 4? I'm wondering when it got.
It goes from, sorry, it goes 1, 3, 5, 7.
No. All right. This afternoon, I will. I'll rescan it in and upload it.
Okay.
It must have just when she scanned it in, she must have clicked one-sided, and it only took our top slide. So I will highlight it in and make sure it's double-sided and upload it this afternoon.
Okay.
I guess for this next couple pages, there's only a couple highlights through here. We'll slow down when we get to them, and you can write them down and then highlight them back in when you get the real pages.
Sounds good.
All right. So yeah, I am on page 2. I'm sorry. All right. The term AIDS applies to the most critical. Oh, we said that. The CDC definition of AIDS includes all HIV-infected people who have fewer than 200 CD4 positive T cells per cubic millimeter of blood. Healthy adults usually have T cells counts of 1,000 or more. In addition, the definition includes 26 clinical conditions that affect people with advanced HIV disease. Most of these conditions are opportunistic infections that generally do not affect healthy people. In people with AIDS, these infections are often severe and sometimes fatal because the immune system is so ravaged by HIV and the body cannot fight off certain bacteria, fungi, parasites, and other microbes. Symptoms of opportunistic infections common in people with AIDS include coughing, shortness of breath, seizures, lack of coordination, difficult or painful swallowing, mental symptoms such as confusion and forgetfulness, severe and persistent diarrhea, fever, vision loss, nausea, abdominal cramps, and vomiting, weight loss and extreme fatigue, severe headaches, and coma. Gosh. Children with AIDS may get the same opportunistic infections as adults with the disease. In addition, they may also have severe forms of typically common childhood bacterial infections, such as conjunctivitis or pink eye, ear infections, or tonsillitis. All right, this is a highlight here. People with AIDS are also particularly prone to developing various cancers. Especially those caused by viruses such as Kaposi sarcoma and cervical cancer, or cancers of the immune system, such as lymphomas. These cancers are usually more aggressive and difficult to treat in people with AIDS. Signs of Kaposi sarcoma in light-skinned people are round, brown, reddish, or purple spots that develop in the skin or in the mouth. In dark-skinned people, the spots are more pigmented. During the course of HIV infection, most people experience a gradual decline in the number of CD4 positive T cells, although some may have an abrupt and dramatic drops in their CD4 positive T cell counts. A person with CD4 positive T cells above 200 may experience some early symptoms of the HIV disease. Others have no symptoms, even though their CD4 T cells continue to count is below 200. Many people are so debilitated by the symptoms of AIDS that they cannot hold a steady job nor do household chores. Other people with AIDS may experience phases of intense life-threatening illnesses, followed by phases in which they function normally. A small number of people first infected with HIV 10 or more years ago have not developed symptoms of AIDS. Scientists are trying to determine what factors may account for their lack of progression into AIDS, such as whether their immune systems have particular characteristics, whether they are infected with a less aggressive strain of the virus, or if their genes may protect them from the effects of HIV. Scientists hope that understanding the body's natural method of controlling infection may lead to ideas for protective HIV vaccines and use of vaccines to prevent the disease from progressing. Diagnosis. Because early HIV infection often causes no symptoms, your healthcare provider can usually diagnose it by testing your blood for the presence of antibodies or disease-fighting proteins. HIV antibodies generally do not reach noticeable levels in the blood for 1 to 3 months following infection. It may take antibodies as long as 6 months to be produced in quantities large enough to show up in standard blood tests. So that's kind of what they're doing with the coronavirus now with the antibodies and trying to find antibodies within people. It's really apropos that we're reading about this. It's information that's quite pertinent to things going on in our world. Hence, to determine, now we're on page 3, whether you have been recently infected, an acute infection, Your healthcare provider can screen you for the presence of HIV genetic material. Direct screening of HIV is extremely critical in order to prevent the transmission of HIV from recently infected individuals. If you have been exposed to the virus, you should get an HIV test as soon as you are likely to develop antibodies to the virus within 6 weeks to 12 months after the exposure of the virus. By getting tested early, and if infected, you can discuss with your healthcare provider when you should start treatment to help your immune system combat HIV and to help prevent the emergence of certain opportunistic infections. See the section on treatment below. Early testing also alerts you to high-risk behaviors that could spread the virus to others. Most healthcare providers can do HIV testing and usually offer you counseling at the same time. Of course, you can be tested anonymously at many sites if you are concerned about confidentiality. Healthcare providers diagnose HIV infection by using two different types of antibody tests. They have the ELISA and the Western blot. If you are highly likely to be infected with HIV but have tested negative for both tests, your healthcare provider may request additional tests. You may also be told to repeat antibody testing at a later date when antibodies to HIV are more likely to have developed. Babies born to mothers infected with HIV may or may not be infected with the virus, but all carry their mother's antibody of HIV for several months. If these babies lack symptoms, a doctor cannot make a definitive diagnosis of HIV infection using standard antibody. Healthcare providers are using new technologies to detect HIV more accurately to determine HIV infection in infants between the ages of 3 to 15 months. They are evaluating the number of blood tests to determine which ones are the best for diagnosing HIV infection in babies younger than 3 months. Treatment. When AIDS first surfaced in the United States, there were no medicines to combat the underlying immune deficiency, and few treatments existed for opportunistic diseases that resulted. Researchers, however, have developed drugs to fight both HIV infection and its associated infections and cancers. So HIV infection. The Food and Drug Administration has approved a number of drugs for treating HIV infection. The first group of drugs used to treat HIV infection, called nucleoside reverse transcriptase inhibitors, or RT inhibitors, interrupts an early stage of the virus making copies of itself. These drugs may slow the spread of HIV in the body and delay the start of opportunistic infections. This class of drugs, called nucleoside analogs, include, and I'm not going to read them because they all are a mouthful. Healthcare providers can prescribe non-nucleoside reverse transcriptase inhibitors, or NNRTIs, such as, these are a little easier, delaravine, nevirapine, ephravirine, sustiva, in combination with other retroviral drugs. The FDA also approved a second class of drugs for treating HIV infection. These drugs, called protease inhibitors, interrupt the virus from making copies of itself at a later step in its cycle, and they include ritonavir, sadaconavir, indianavir, ampirinavir, nelfinavir, lopinavir, atazanavir, and fosamaprevir. When we say that vir, I'm assuming it's all pertaining to virus. FDA has also introduced a third class of drugs known as fusion inhibitors to treat HIV infection. Fusion, or enfertirtide, or T20, the first fusion inhibitor, works by interfering with HIV-1's ability to enter into cells by blocking the merging of the virus with the cell membranes. This inhibition blocks HIV's ability to enter and infect the human immune cells. Fusion is designed for use in combination with other anti-HIV treatment. It reduces the level of HIV infection in the blood and may be active against HIV that has become resistant to current antiretroviral treatment schedules. Because HIV can become resistant to any of these drugs, Healthcare providers must use a combination treatment to effectively suppress the virus. Let's go ahead and highlight here. When multiple drugs, 3 or more, are used in combination, it is referred to as highly active antiretroviral therapy, or HAART, and highlight, and can be used by people who are newly infected with HIV as well as people with AIDS. Researchers have credited HAART as being a major factor in significantly reducing the number of deaths from AIDS in this country. While HAART is not a cure for AIDS, it has greatly improved the health of many people with AIDS and reduces the amount of virus circulating the blood to nearly undetectable levels. Researchers, however, have shown that HIV remains present in hiding places such as lymph nodes, brain, testes, retina of the eye, and even in some people who have been treated. Side effects. Despite the beneficial effects of HAART, there are side effects associated with the use of antiretroviral drugs that can be severe. Some of the nucleoside RT inhibitors may cause a decrease in red and white blood cells, especially when taken in later stages of the disease. Some may also cause inflammation of the pancreas and painful nerve damage. There have been reports of complications and severe reactions, including death, to some of the antiretroviral nucleoside analogs when used alone or in combination. Therefore, healthcare experts recommend that you be routinely seen and follow your healthcare provider, followed by your healthcare provider if you are on any antiretroviral therapy. The most common side effect with protease inhibitors include nausea, diarrhea, and other gastrointestinal problems. In addition, protease inhibitors can interact with other drugs, resulting in serious side effects. Fusion may also cause severe allergic reactions such as pneumonia, trouble breathing, chills, fever, skin rash, blood in the urine, vomiting, low blood pressure. Local skin reactions are also possible since it's given as an injection underneath the skin. If you're taking HIV drugs, you should contact your healthcare provider immediately if you have any of these symptoms. Opportunistic infection. A number of drugs available to help treat opportunistic infections. These drugs include fosacarnet or ganciclovir to treat CMV, eye infections, fluconazole to treat yeast and other fungal infections, or TMP SMX, I'm not even going to try reading that, or pentamidine to treat PCP, which is a type of pneumonia. Cancers. Healthcare providers use radiation, chemotherapy, or injections of alpha interferon, a genetically engineered protein that occurs naturally in the human body, to treat Kaposi's sarcoma or other cancers associated with HIV infection. Prevention. Because no vaccine for HIV is available, the only way to prevent infection by the virus is to avoid behaviors that put you at risk for infection, such as sharing needles and having unprotected sex. Many people infected with HIV have no symptoms. Therefore, there is no way of knowing with certainty whether your sexual partner is infected unless he or she has repeatedly tested negative for the virus and has not engaged in any risky behavior. Although some laboratory evidence shows that spermicides can kill HIV, researchers have not found that these products can prevent you from getting HIV. A good movie to watch, if you haven't ever seen it, is Philadelphia with Tom Hanks and Denzel Washington. It kind of gives a picture of the culture of when HIV and AIDS was emerging in America and how people were severely mistreated who had the disease. All right, and on this page, we're going to see a bunch of dates. We're just going to go over a couple of them here. The first one you will see is 1981. That's a highlight. Unexplained cases of enlarged lymph nodes among men are observed and studied by physicians and researchers in New York City. US total cases reported, 159. So we need to highlight 1981 and US total cases reported 159. On the opposite column, we'll see the year 1991. The CDC reports that 1 million Americans are infected with HIV. Irvin Magic Johnson announces that he is infected with HIV. Total US cases reported 206,563. And there is 156,143 deaths. That's a highlight. So 1991 and US total cases reported 206,563, 156,143 deaths. Let's turn over to page 5. Another date I want you to highlight is 2001. US Secretary of State, A new study shows that 14% of individuals newly infected with HIV and in the US already exhibit resistance to at least one antiretroviral drug. The United States Secretary of State Colin Powell reaffirms that the position that HIV/AIDS constitutes a national security threat. Let's come back up to the very top of this page here. How does HIV research help with the cure of other diseases? Many ask how HIV and AIDS affects me and why research is so important. We're going to highlight here. The fact is, HIV/AIDS research is helping solve many other medical mysteries. And highlight. Treatment for several types of cancers have grown directly out of AIDS research. One promising experimental therapy for advanced cancer is high-dose chemotherapy followed by a bone marrow transplant. But the profound immune suppression necessary for successful transplant often leads to devastating, even fatal infections. New drugs to treat and prevent these infections have come directly from AIDS-targeted research. Treatments for other cancers are also emerging from AIDS research. Several natural body hormones called growth factors promote the activity of HIV. Many of these hormones also accelerate the growth and spread of cancer cells. By blocking the activity of these hormones is a strategy first used experimentally to treat Kaposi's sarcoma, a cancer found in patients with HIV/AIDS. Now it is also being tested in bladder, vulva, and breast cancers, and has shown some exciting recent success in treating colon cancer. In addition, small proteins and drugs that can block growth of new blood vessels, which is critical to the survival of tumor cells, were originally developed to treat Kaposi's sarcoma, but are now being tested in many other cancers as well. Are other treatments for major diseases likely to emerge from AIDS research anytime soon? Absolutely. AIDS research is helping improve treatments for Alzheimer's disease and heart disease. Alzheimer's disease is a progressive global dementia whose cause is unknown. Profound dementia is commonly seen in late stages of AIDS as well. So drugs that are successful in lessening nerve damage and dementia in AIDS, for example, may benefit patients with Alzheimer's. The characteristic plaques that fill the brain cells of Alzheimer's patients are formed partly by enzymes called proteases. So scientists are now investigating the use of protease inhibitors to treat this debilitating dementia. Many HIV-positive children and adults also suffer heart attacks and strokes because HIV appears to affect small blood vessels in the heart and brain, which makes them vulnerable to spasm, blood clots, and early arteriosclerosis. The small arteries of a 2-year-old child with AIDS often resemble those of a 50-year-old man. In HIV infection, a small program cell death injuries, the cell that line the blood vessels of the heart. Similar damage occurs in HIV negative people with arteriosclerosis. Discovering a way to block this process may benefit not only those with AIDS, but a much broader population as well. How does the study of HIV/AIDS help in the treatment of other diseases? HIV/AIDS therapies may be critical in the treatment of other diseases. For example, lamivudine and adefovir can help patients with hepatitis V that have no other options. In addition, protease inhibitors are being used to combat infections such as hepatitis C, influenza, and most recently SARS is based on the concept similar to that of an anti-HIV entry inhibitor called Infertivide or Fusion, which was approved for use in 2003. A modified version of another AIDS drug called Cidofir, used to treat CMV infections in AIDS, is now being developed to treat and possibly prevent smallpox infections. Go ahead and highlight here. AIDS drugs have been used to eliminate disease in plants. And highlight two of them, Adefovir and Tenofovir, can eradicate the banana streak virus, which infects a substantial portion of the world's banana harvest. Yeah, plants are susceptible to disease just like we are, actually the banana more so than most plants. Since HIV is a virus that attacks the immune system, what does AIDS research teach us about autoimmune disorders or immune-based therapies for other diseases? HIV positive people often develop autoimmune problems such as psoriasis and blood-borne abnormalities associated with lupus. For these autoimmune diseases, treatment developed for AIDS should also apply to when the same conditions occur spontaneously. Certain hormones that modify the functions of immune cells are now being tested as treated for AIDS. Some of the most recent include IL-12 and TNS, or tumor necrosis factor alpha inhibitors, which may boost the immune system of cancer patients. Workplace accommodations for employees with HIV and AIDS. People living with HIV infection and AIDS can be productive workers for many years. Even in the best of circumstances, the challenges associated with HIV can be significant. In addition to complex medical and legal concerns, AIDS raises difficult emotional issues such as fear, stigma, death, and dying. HIV/AIDS is an increasingly important issue in workplaces throughout the country. Now, this is a highlight. I know we're on an even numbered page. So 2/3 of large businesses and 1 in 10 small businesses have already encountered an employee with HIV infection or AIDS. I'll say it again. 2/3 of large businesses and 1 in 10 small businesses have already encountered an employee with HIV infection or AIDS. We have another highlight right behind it. More than 75% of all AIDS cases occur among people between the ages of 25 and 44. More than 75% of all AIDS cases occur among people between the ages of 25 and 44. Right. And your highlight. The same group compromising the bulk of the US workforce. All right. Employment provisions under the Americans with Disabilities Act of 1990. This is also a highlight. The Americans with Disabilities Act, ADA, prohibits discrimination against all people with disabilities or perceived disabilities, including people with HIV infection and AIDS. The American with Disabilities Act prohibits discrimination against all people with disabilities or perceived disabilities, including people with HIV infection and AIDS. End highlight. A detailed explanation of the ADA is beyond the scope of this publication, but can be found at their website. Similar legal requirements have been placed for employers covered by the Rehabilitation Act and by certain state and municipal ordinances covering disability discrimination in employment. The employment provisions of ADA also require employers to provide reasonable accommodations for employees with disabilities. Reasonable accommodations are changes or adjustments in the job or work environment that prevent individuals with disabilities to perform the essential function of a job. The term reasonable accommodation is a legal term that refers to the certain changes and adjustments in the workplace. An employer may choose to go beyond ADA and provide accommodation that would not be required under law. For example, removing an essential function from an employee's job description and providing HIV education for all employees are not examples of reasonable accommodations. Similarly, while allowing an employee to work part-time is a part of reasonable accommodation, continuing to pay that employee full-time salary is not required by law. The ADA establishes a baseline, a floor, not a ceiling. So they set the baseline of what you must accommodate for, and then it's up to the employer if they exceed those accommodations. Specific legal boundaries of reasonable accommodation. Employers and employees trying to determine appropriate accommodations should be aware of specific legal boundaries of reasonable accommodation. Many employers profiled in these case studies provided assistance and accommodations that went above and beyond what the law would require. As a general rule of thumb, given that the ADA governs many of the actions in this area, employers should consider the ADA implications of any decisions involving an employee with HIV infection or AIDS. This includes any decision about disclosing an employee's HIV status. The ADA has strict rules about maintaining confidentiality of such information, and employers should ensure that they do not violate these rules. As awareness of ADA and its employment provisions increases, more and more employees are stepping forward to disclose their HIV status to their employers, managers, coworkers, and friends. Disclosure often takes courage and is unlikely to happen without an environment in which disclosure will be met with cooperation and support. Because of the stigma still associated with HIV, this disclosure, especially in the workplace setting, too often does not occur until a crisis forces the issue to come out into the open. By this time, an otherwise manageable situation can become a crisis, and everyone loses: the HIV positive employee, the employer, the manager, coworkers, and worksite. Many employers believe that encouraging disclosure may not have been desirable because it creates a certain obligations that might not have otherwise existed. An environment that discourages or is hostile to disclosure, however, may prevent altogether different problems, legal and otherwise. Just as a company experiences similar problems when it does not encourage employees to come forward with harassment complaints. Most human resource professionals agree that providing an environment where complaints or situations, such as the existence of disability and the need for accommodation, can be discussed and remedied without fear of retaliation is a sound policy for overall productivity and legal reasons. There is no simple formula for accommodation of employees with HIV infections or AIDS. The dual goals of accommodation are to ensure that the work assignments are accomplished and the individual with HIV infection or AIDS continues working as long as possible. Accommodation is a process of ongoing problem solving between an employee with HIV infection or AIDS or his or her supervisor. Because the manifestations of HIV infection and AIDS are different in different people, accommodation is not a one-time alteration of job or physical structure. Just as each person with HIV infection and AIDS experiences the disease differently, each person will require different accommodations. An accommodation that is effective for an earlier phase of HIV infection may not be effective in a later phase. An accommodation that is ongoing process requiring ongoing evaluation, excuse me, I'm sorry, in part because of the manifestation of HIV infections and AIDS change over time, is part because some attempted accommodations may not work for either the employer or the employee. Effective accommodation does not require lowering the expectations of the employee. Rather, it requires ongoing negotiation and creative problem solving to determine alternate means of accomplishing work assignments. This negotiation process may result in different outcomes in similar circumstances. So since the disease presents itself in a different fashion with every single person, no two people experiencing the disease will experience it the same way. Even if they have the same job, they won't be accommodated in the same way. For example, one employee might convert a full-time job to part-time. Providing accommodation to employees with HIV infection or AIDS is a team effort with impact on the company's workforce, manager, and policies. Because of fear and stigma still associated with HIV and AIDS, accommodating people with HIV infection and AIDS affects virtually everyone in the workplace. A fearful work environment is not a productive work environment. In the process of providing accommodation of employees with HIV infection or AIDS, an employer might consider addressing coworker attitudes. In order to dispel unwarranted fears and to ensure cooperation in the accommodation process, managers need accurate information about HIV infection and AIDS. Confronting AIDS also involves confronting grief. Coworkers and managers in these profiles respond constructively in a supportive environment where emotional responses to HIV could be addressed. Leadership is an important part of an effective accommodation. A message from the manager about how an employee with HIV infection or AIDS will be treated is critical because it sets a clear standard. So the person leading the pack will set the tone for the way that the person with AIDS or HIV is treated, which is respectfully, hopefully. But if that person leads from a place of fear, their workforce is going to perceive fear, which is completely unwarranted. The benefit of accommodating employees with HIV infection and AIDS: balance the cost. Companies that effectively manage HIV and AIDS grow stronger. How a company treats one employee with a chronic illness is a clear indicator and signal of the standard it will use when managing other employees. Witnessing support, accommodation, and respect for a coworker with a terminal illness strengthens worker morale, loyalty, and productivity. Coworkers and supervisors share a deeply human connection. Employers have satisfaction of knowing they are making a contribution to the dignity and well-being of one of their own employees. Go ahead and highlight here. Sometimes companies directly benefit from accommodations as well. And highlight. One company working on a commission-based pay wanted to reduce the sales pressure by his income depending directly on his daily sales. His accommodation including converting from commission-based pay to a fixed salary. When his sales were high, this arrangement benefited the company since it kept the commissions he would have received. Companies benefit when employees who become ill can help train other employees to share and eventually assume some of their responsibilities. The expertise of a knowledgeable and experienced employee is thus passed to a new employee. This may also give ill employees some peace of mind knowing their responsibilities are being taken care of in their absence. Employees who fully disclosed their HIV status in the workplace felt relieved and strengthened. Being an employee with HIV/AIDS, as one interviewee described, is not for cowards. The employee must manage overwhelming emotions of facing a terminal or often stigmatizing illness while still continuing to be a productive worker. People with HIV infection and AIDS are challenged to manage and plan for ever-changing set of ailments, healthcare needs, and financial demands, all while maintaining motivation and self-esteem. HIV positive employees must decide whom to inform about their health status, how much information to reveal, and when to reveal it. The stigma associated with HIV/AIDS makes such decisions all the more difficult. Fear of rejection, regrettably, is fear based in reality. Go ahead and highlight on the next column. The decision to disclose HIV status is the prerogative of the HIV positive individual. And highlight. It is illegal for an employer to ask the current or prospective employee about HIV status. Nonetheless, the HIV positive employee may have to disclose some health information to managers or supervisors in order to seek accommodation. Accommodations can be made without the supervisor knowing the individual is HIV positive or has AIDS. The supervisor may know only that the individual is ill. Disclosure of one's HIV status can take place in many settings. Some employees have chosen to disclose it in letters to colleagues or work groups. Others do so in face-to-face meetings with individuals or groups. Intensive workplace AIDS education may precede or follow disclosure. Employees may inform managers of their health conditions, but request that the information be kept confidential. And by law, the employer must comply with that request. Over time, however, if coworkers unaware of the circumstances become suspicious of perceived preferential treatment, they may become resentful and spend considerable time, energy, and effort trying to figure out what's wrong. Rumors may circulate. When the performance of their work groups is called into question by superiors, managers may find themselves unable to adequately explain the situation. In such circumstances, the employee may be uncomfortable as well, knowing of the rumors circulating and feeling the unwanted attention from others. At that point, it may be helpful for the manager to discuss with the employee what, if anything, he or she wants to do to address the situation. The decision to disclose rests with the employee, but the employee may be willing to risk disclosure if the manager is not forcing the individual to disclose, but instead offers support for whatever decision is made. Finally, many employees with HIV/AIDS, believing that continuing to work is critical to their mental and physical health and survival, work can provide a sense of purpose, financial support, productiveness, continuity, involvement, peer support, and the opportunity to focus on something other than one's illness. In our culture and society, a person's work and profession often hold deep ethical, economic, and personal significance. The importance of work and the workplace context for people with HIV infection and AIDS should not be underestimated. Indeed, for some, keeping a job may mean keeping the will to live. So what they're saying here is the obstacles that this may present being preferential treatment by accommodating them for doctor's appointments or illness or what have you. They may be perceived by other people among the workforce that don't know exactly what's going on, and they're only seeing preferential treatment. They don't know the other side of the coin. So it's up to the employee to decide whether they want to fill in the story and say, hey, this is why I'm getting this preferential treatment, because I'm dealing with this. But it's profoundly personal for each person and not necessarily going to benefit, because you can't dictate how each person is going to react and whether or not they're going to react in a friendly way. All right. Are there any questions about the two packets that we went over today?
Nope.
Okay. I will go ahead and get this scanned in and into MindTap so that you can have it for all your notes. I'm sorry it didn't get put in there properly.
Oh, it's fine.
Whoopsie. All right, so we'll go ahead and end today's meeting, and I guess you'll be in class on Wednesday. You'll be in residential class, yes?
I will not. I will be doing distance until the 31st.
Oh, okay.
Yeah,
No problem.
so I'll still be here through the end of the month.
And so we keep an eye out for emails just because we are going to have some people returning to residence learning here.
Okay.
So Zoom meetings might change.
Okay.
I don't think it'll affect you guys because you guys are Monday and Wednesday, and that's when the massage is in session here. We have some Tuesday and Thursday, so Thursday might need to be rearranged. But just to keep an eye on your email, just in case anything does change.
Okay.
All right? And we
All
will
right.
see you next time.
All right. Thank you, Miss Christina.
Thank you. Bye.